I'm Stephanie Winfield with the Office of Public Health Practice Planning and Local Partnerships at the Colorado Department of Public Health and Environment. Can you both tell us your name, your roles, and how long you've been in your positions?
Sure. My name is Abby Baker. I am the director at Grand County Public Health. I started with Grand County Public Health in March of 2018 and moved into the executive director role at the beginning of 2021 after the departure of our previous public health director.
And I'm Rich Cimino. I'm a Grand County Commissioner since 2017, and we co-serve as the local Board of Health.
Great. So Abby, starting with you, and then Rich, tell us a little bit about what you do every day in your role as executive director and in your role as the Board of Health member.
Day-to-day operations for an executive director really involves navigating local health needs in our community, taking a look at data to help support those needs, focusing on internal operations like budgeting, funding, reporting, making sure we have personnel that feel supported and have the trainings that they need, looking at community and state partnerships and collaborations. Another big part of our role is keeping our Board of Health, which in our county is also the Board of County Commissioners, informed of important things happening and decisions that may be coming to their table during a meeting and any upcoming challenges we foresee.
Yeah, on a day-to-day basis, the local Board of Health, we aren't as hands-on as the public health director, but we stay in tune with the community. We are constantly, since we also serve as the Board of County Commissioners, are interacting with the community, the business leaders, the stakeholders, the schools, the hospitals. And so the most important thing any Board of Health has to do is make that selection for the public health director. And that's just such a key thing that I would encourage all boards of health to very, very carefully consider, because it's about a role for your community.
Thank you. So understanding how you each work, how do you work together as a Board of Health member and executive director?
I think probably one of the key components of us working together is making sure that we are coming from the same place, that we have the same information so that we can make those vital decisions for our community and have a united front when we are in front of our public. It really helps to make sure that we explore all avenues, sometimes in a public forum, so that our community also understands that the right questions are being asked and they are getting the answers that they need to feel confident in the decisions that are being made.
Yeah, the way we communicate and work together between the Board of Health and the public health director is frequent communication, collaboration, diving deep, asking each other questions, and trying to anticipate where the public might feel about the public health direction or programs we're running or policies that we need to implement. And we really try to explore both sides, those of our community that might feel that public health isn't doing enough, or those that might feel public health is doing too much. It definitely goes both ways. And if we could collaborate and communicate together more frequently, the better we're able to respond to both sides and develop policy that really meets the needs of our community without alienating people.
What have been some of the challenges? Obviously, there's many, and the successes as well, because clearly that's a successful relationship.
So for challenges, I think probably the hardest thing is when there is something urgent that comes up. A lot of times we do have to wait for a Board of County Commissioners meeting, so we have to meet that public notice requirement. There is definitely an opportunity for emergency situations, but there's still a time frame that you have to notify the public of that meeting prior to having that meeting. So that does create some difficulties when there's a decision that needs to be made fairly quickly. The other difficulty is a lot of our conversations and like Rich said, the deep dives that we have to really get into happen in a public forum. So things can be somewhat difficult to gauge the level of depth you need to go into on a subject before you move on to being able to make an informed decision about a policy or an action that public health and or the Board of Health need to make.
Yeah, some of the challenges and successes that we've experienced as a Board of Health and a public health director relationship and serving our community is kind of one and the same. When the Board of Health is also the Board of County Commissioners, sunshine laws in Colorado require public notice whenever we're going to have a meeting. So there's opportunity for the media to come, for the public to come. And we also make virtual options available for anyone to observe our meetings virtually, which I think is really a positive thing. But there's a time requirement for that. So there's a bit of a delay whenever a meeting needs to happen. So that's a challenge. But the benefit of it is every time we discuss the dynamics of public health or a policy that we're working on or a public health order that we need to enforce, that all happens very publicly. We allow the public to ask questions during those meetings, and the challenge is also, I think, contributing to the success with making sure everything is done in a way that everyone can see and hopefully understand.
Yeah, I like that. Challenge and success at the same time. Did you want to add some successes as well?
Yes. So another element to our structure with the Board of Health serving as the Board of Health, there's not really a recruitment process for board members on the local Board of Health. Since our commissioners are an elected official, those seats stay filled. So it's not the requirement is 3 to 5 members. It helps us to make sure we have equitable representation of our community in addition to just different area perspectives to help aid in decisions that need to be made.
Yeah, if I could add to that, something about our cooperation, Board of Health and Public Health Director, is the selection and cooperation with the medical director. And so, usually the county will appoint a doctor in collaboration with the Public Health Director to be that advisor. Public health directors often have master's degrees, they're highly educated in the field of public health, but someone who's gone through medical school contributes, I think, to the analysis of the situation and the way to have a community policy that is most effective. And so I really encourage boards of health to think very seriously about who they appoint public health director and who they appoint for the medical director of the public health function.
Yeah, we're talking about mostly your relationship right now, but you're right that the board interacts with the department in a lot of different ways with a lot of different positions.
Yeah, and if I could just add to the way the teamwork happens between the Board of Health and the Public Health Department, it's the medical director, it's the public health director, but then the staff that Abby does recruit and hires and trains and builds up. That's just a really important team, and there's so many functions that need to happen that we need to just all, the united front is very important, and Abby often informs us about what members of her staff are doing and challenges they faced and solutions they found, and so that just helps us also as a Board of Health to then talk to the community and help them understand what happens with the whole team that she has.
Yeah, so you've talked about trust and the relationship and how important communication is. So if you can talk a little bit more about communication and how you keep those lines open and what structures you've put in place to ensure some positive and helpful communication.
So my typical information to the Board of Health is actually given within 4 or 5 days prior to the meeting, if possible. I write up a brief summary or an overview of what we'll be going over during the Board of Health meeting so that they have an opportunity to understand if there's an ask or if there are questions that they may have for me. So that way they're ready to respond when I pose the questions so that they don't feel bombarded or sidelined by anything that I may come to them with. There's also a lot of discussion before informing the Board of Health with, my medical director. Is this the best option? What are the other opportunities we may have prior to taking all of that to the board? So it's really concise and well thought out prior to handing that over to them for consideration. And then, if they're hearing things from the public that they would like for me to address during the Board of Health update or a Board of Health meeting, I have time to process the question and find the appropriate information to back up anything that may be stated or any decisions that are made.
So that advanced communication really sets you up for success.
Yes, I think the advanced communication sets us up for success, and I think we try as a Board of Health to be very, let's try to provide the toughest questions we could think of to our public health director. Let's try to really think what are the highest criticisms of this upcoming policy so that we're prepared. And sometimes we're able to answer the question of the public, and sometimes we're able to, maybe we tweak our policy slightly because there might be a significant amount of opposition. Can we still accomplish the same public health goals in a slightly modified way? So it goes both ways, I think. Help the public understand, but maybe change what we're about to do so that the public's more accepting and therefore we have better success with the policy.
Mm-hmm. I'll add to that having that outside perspective, as an executive director, you live in the public health world and you have a lot of meetings and that you speak, eat, and breathe public health and environmental health and all of the things that go under the public health umbrella. So having a outsider perspective to ask questions really does help to make sure that we're addressing unforeseen consequences that may come out of policy or decisions that are being made at our level, or making sure that we have an opportunity to address things that that may become problematic prior to a problem occurring.
Can you share an example of a project that you've worked on together or that you're currently working on?
Yeah, so every 5 years under statute, public health is required to do a community health assessment. So we are embarking on our third community health assessment process right now, and we'll be leaning on our Board of Health a lot to help us guide the improvement plan that comes out of that community health assessment and helping us engage other community members that we may not have in the forefront of our mind for involving in the process.
We always incorporate all the community stakeholders. So we have our public health departments and their expertise and the medical director there. We also pull in the schools, the business community, the nonprofits, and it's actually a partnership. It's led by our public health director, Abby, but we use the Grand County Rural Health Network to pull in all the various stakeholders in a really robust way. And it also helps in the implementation of the plan after it's published. And we want to make sure it's productive. We want to make sure it accomplishes goals. And so the Board of Health will remain active in executing the plan, as well as the Rural Health Network and our public health departments and the community stakeholders to just check off that list of goals and make sure we are actively taking actions for years following that plan. And then we'll measure those results in 5 more years. And that's a good project.
Great example of community collaboration and bringing in different aspects of your community to represent all the needs. Thank you for sharing that one. Do you have any other tips or suggestions or ideas for other pairs of executive directors and Board of Health members for successful relationships and working together?
A great tip with working with a Board of Health and the public health director is keeping open and honest communication and keeping it consistent. We found that when there is a particularly difficult conversation to be had during a public meeting, having that information beforehand to prepare your responses and to consider possible changes or how you would approach the topic in the public forum, you're ready and you don't feel like you've been sidelined by a question. Let's see, it does help to have the information beforehand. So a brief email summary from them to me with questions they come up with, or from me to them. So if I know there's a policy coming up that we need to discuss, or there's a decision that needs to be made, they have an opportunity to consider their responses and any questions they have prior to meeting in that public forum.
Yeah, a tip I would recommend for other county boards of health is to have a bit of a tempo and a process with your public health director that is very exploratory. It's very direct, and try to allow for tough questions to be fielded back and forth, and try to have a regular updates to the Board of Health so that the community understands where things are heading in the state and where we might be influenced by something happening somewhere else. The rural communities might see something come from the urban areas or vice versa. So it's really important to be honest, to be direct. And the process that we follow is when a policy is upcoming or anticipated, our public health director tries to give us as much advance notice as possible. And then we have the open meeting and we field the questions and we let the public speak. And yeah, we have put our public health director on that podium to field questions live so many times. And it keeps her on her toes. And if we do our job well, we've successfully, ahead of time, anticipated what questions are going to come. Sometimes there's some surprises, but that preparation still helps, even when those original questions come up that we did not anticipate.
Mm-hmm. I will add too that keeping that open communication really helps when there's a change in membership to the Board of Health. With our structure, with the Board of County Commissioners serving as our Board of Health, when there's a new member, when a term comes up or when an election takes place, we have an opportunity to really start building trust from day one. We're having communications, we're making sure that that knowing what's coming before a decision has to be made or before we have to address questions from the public, so that we have an opportunity to be informed, to present to the public as a united front. But it helps to build that relationship from the beginning, so that getting the hang of being part of a Board of Health maybe isn't so drastic.
I agree.
Those were great tips, and I really appreciate it. I hope that they'll help other executive directors and board members see how successful a working relationship can be. So thank you so much for sharing all of that with us today.
Thank you for having us.
Yes, thank you.